Good afternoon, everyone. My name is Courtney Goodwin. I am the social media manager at Prisma Health. On behalf of Prisma Health, we would like to thank you for joining us for another Facebook Live Town Hall. March is National Kidney Month, and kidney disease is often referred to as a silent disease because there are usually no symptoms in its early stages. In fact, as many as 90% of Americans who have chronic kidney disease, also known as CKD, don't know if they have it until it has advanced. The good news is the earlier you find out you have kidney disease, the sooner you can take the steps to protect your kidneys from further damage. So today we have a great panel of experts who will answer questions related to kidney health and how you can recognize the signs of kidney disease. So on our panel today, we have Dr. Robert Holleman. He is a pediatric nephrologist in the Midlands. We have Dr. Carlos Zayas. He's a transplant nephrologist in the Upstate. And later on, we will have Dr. Jaqui Jones, family medicine physician in the Midlands. So thank you all for joining us today. So the first question will go to Dr. Holleman. So what are the signs you might have a kidney infection?
Well, Courtney, I think you hit the nail on the head when you said there often aren't any. And if they are, they are rather vague, which makes it difficult to diagnose. But patients with chronic kidney disease at advanced stages might experience things like unexplained fatigue, loss of appetite, unexplained nausea. And certainly in my pediatric world, there may be issues with poor growth, not meeting developmental milestones on time, or since many of our patients have underlying urinary tract issues, they may have recurrent urinary tract infections as well. So the symptoms are definitely vague and hard to pinpoint sometimes.
Thank you for that. Next, we're going to go to Dr. Zayas. So your question is, are kidney stones considered kidney disease?
So Courtney, kidney stones are more a condition or a metabolic syndrome that if untreated or if they become recurrent could lead to chronic kidney disease. But kidney stones by themselves are not considered kidney disease. It requires a lot of damage to the kidneys to really get to the point where they develop, what we call chronic kidney failure, which is basically loss of kidney function over time. The good news about kidney stones, especially here in the South, where our diet is very rich in oxalate, and some of the things we eat could lead to formation of stones. And during the summer month, we get dehydrated because we don't drink enough. We can say that if we modify how we drink, what we drink, and what we eat, we can alter the outcome of these stone formations.
Thank you. That was great information. So now we're going to head back over to Dr. Holleman for the next question. Dr. Holleman, so what are the earliest signs of kidney disease?
Well, I think we kind of touched on that a little bit, Courtney, with the vagueness of the symptoms, but perhaps we can expand on that by symptoms or signs that might be detected when you go see your primary care physician, for example. You might have an unexplained elevation in blood pressure, or your urine might be screened in your pediatrician's or adult primary care provider's office, and you might find evidence of having protein in the urine, which could be an indicator of chronic kidney disease. So in addition to those vague symptoms that can occur, and knowing that certainly in the earlier stages, there are often no symptoms, those would be a couple of additional findings that can be seen with chronic kidney disease.
Thank you. All right, so the next question, going back to you, Dr. Zayas. How are kidney disease and heart disease related?
That's a fascinating question because they do have one common link. And the common link between heart disease, organic heart disease, coronary artery disease, and chronic kidney disease is hypertension. The other link that we have is diabetes. Those two conditions that are very prevalent in the South US are both implicated in the development of coronary disease, organic heart disease, and hypertension. So the issue here is that someone that develops heart failure or coronary artery disease could develop kidney disease as a consequence of the first one. Because think about the heart as a magnificent and complicated pump that sends blood to be filtered in these organs that we call kidneys, that are sophisticated filters. If the pump doesn't send enough blood to the kidneys, they don't filter very well, right? So they don't get enough blood supply, not enough oxygen. On one end, then if they don't filter, toxins are accumulated, which make you sick. The urea, especially the bun, which will give you the symptoms of chronic kidney disease. The water that is not excreted, so circulation of fluid in your lungs, in your legs, in your abdomen, the congestive heart failure-like symptoms, and the accumulation of electrolytes that can make you have heart arrhythmias, like potassium, for instance. That can happen also in the setting of diabetes when the heart gets enlarged because of uncontrolled diabetes. The elevated sugar can make the kidneys malfunction as well, start leaking protein, leaking sugar, and aging at the same time. So you have the two conditions, the blood pressure and the diabetes, leading to both kidney disease and heart disease. So it's complicated, but one organ needs the other to be healthy. Sometimes when we receive a patient coming from cardiology because they have a lot of fluid retention, they're treated with diuretics, and the creatinine or the kidney indexes are going up. In other words, the kidney function is going down. So the question we get asked is, what can we do to actually help the kidneys filter better? Well, sometimes the heart medications that are necessary to make the kidney pump appropriately can make the kidneys unhappy and increase those indexes to the point that alarm primary care physicians and even cardiologists, sending those patients to us in the office. So they're very related, and the best advice I can say to patients is, number one, stay active. Exercise decrease your risk of diabetes because it decreases your body adiposity or fat accumulation, decreases the resistance to insulin, and increases your GFR, or the filtration that your kidneys do. Decreases your blood pressure, which indeed will help your heart pump better, and overall your organism will work more properly. Second, eat a very balanced meal where you're not consuming excess calories that could lead to, again, obesity, which would lead to worsening of insulin resistance and, type 2 diabetes, for instance, and avoiding too much salt. Salt is one of those things that gives life to the food we eat, but in excessive amounts will increase your blood pressure, which would lead eventually to kidney injury and kidney disease.
Well, thank you, Dr. Zayas, for that detailed response. I'm sure our audience would really appreciate that. We're going to move back to Dr. Holleman. So your question is kidney failure common with those with diabetes?
Courtney, this is definitely a tale of two cities between the pediatric population and the adult population. Kidney failure as a consequence of diabetes is exquisitely rare in children, but extremely common in adults. And it has to do with the duration of time your body is exposed to these high blood sugars, and is also related to how well controlled your diabetes is. The origins of chronic kidney disease related to diabetes can certainly occur in children and manifest as having protein in the urine. And so we often get referrals from our endocrine colleagues in their diabetic patients who have developed protein in the urine when they are screened. In the adult world, certainly it is one of the, if not the most common cause of chronic kidney disease and kidney failure. So definitely different in different populations, and most definitely affected by how adequately your diabetes is controlled.
Thank you for that. All right, so the next question, we're going to go to back to Dr. Zayas. All right, so your question is, can kidneys heal if damaged?
So another great question, Courtney. So let's just for sake of an example, analogy, metaphor, we mentioned three main organs: the brain, the kidneys, and the heart. These organs have one thing in common: they're extremely sensitive to oxygen, to lack of oxygen, to what we call ischemia, or when there is no enough oxygen going to the heart, we call it heart, attack, right? An MI. When it happens in the brain, we call it a stroke, or also an infarct. When it happens in the kidney, we also call it an infarct if it's just discrete, but if it happens over a long period of time, we call it kidney injury that leads to what we call total atrophy. With that, I'm saying that over time, if the damage or the lack of oxygen is sustained, the cells in all these three organs will die. And unfortunately, in most instances, they will not recover. The exception, though, is that to some degree, the kidney cells, something called the tubules, can recover from a minor injury if it's treated properly, quickly, and the insult is taken away from the patient. But if the insult is persistent, then it will lead to scar tissue formation. And unfortunately, like in the other two organs, if the scar is formed, there is no scientific way or medical way to remove the scar, and it will lead to continuous loss of kidney function that will lead to basically what we call end-stage. So in broad terms, the kidneys will heal when the insult is stopped quickly. If it persists and is sustained, chances are not there and the kidneys will eventually fail. But once the process of failing starts, it will continue like a cascade, and it will lead to what we call end-stage renal disease.
Thank you. So now we're going to move on to Dr. Jones. I'll place you up here. Thank you for joining us.
Thank you all.
Thank
coming out of patient care, so
yes,
happy to be here. Just got to
No
talk
problem.
about kidneys, by the way. So there's that.
Well, good. Well, this question is for you. So what causes kidney disease?
Well, that's complicated. So kidney disease is caused by many things. As a family medicine physician, the primary things we're talking about in my office for kidney disease is often chronic disease, right? So uncontrolled hypertension, uncontrolled diabetes, but there's also congenital things that damage kidneys. And so autoimmune dysfunction can cause kidney disease. So a lot of my patients that have lupus and other autoimmune dysfunction can sometimes come in with kidney disease. And so there are many ways to find yourself with poor functioning kidneys. It just depends on the individual. So highly common, but very specialized in both ways for each patient.
Right. Thank you. So I have another question for you.
Okay.
Can kidney disease cause high blood sugar?
Can kidney disease cause high blood sugar?
Yes.
It depends on who you're asking. If you're asking my patients, they may say yes, but I would argue it's probably the other way around. And so what I find often is that people have had a long history of blood sugars that just have not been well controlled or not been well controlled consistently enough that over time that does damage to the kidneys. So in primary care offices, you'll often have your urine screen once a year. We're checking a microalbuminuria to make sure that you're not spilling too many proteins in your urine. We are doing that because you have elevated blood sugars. And because you have elevated blood sugars, you have the risk of having chronic kidney disease or acute kidney injuries. So I actually would flip it and I would say uncontrolled blood sugars are a common cause of kidney disease.
Thank you for sharing that. All right, so the next question is going to go to Dr. Zayas. I'm going to pop you back up here. All right. So what is the best diet for someone with kidney disease? And what foods should people avoid?
So let me just say that let's start with the diet that is good for the general public. And my answer to that would be a balanced, balanced diet that includes good hydration, fruits and vegetables, fiber, and a nice amount of, normal amount of protein. Now, for a patient with chronic kidney disease, I would say there are certain nutrients that we need to quantify um, in a discrete manner. First of all, you need to be well hydrated because dehydration in someone with chronic kidney disease could lead to more damage in the sense that they will, lower the blood pressure, and lower blood pressure can lead to hyperperfusion, lack of circulation to the kidneys, which will perpetuate the lack of oxygen and so forth. In what pertains to nutrients, as the kidneys become more deficient in the way they filter and process nutrients, vitamins, and electrolytes, the first thing that comes to mind is a diet that restricts to some extent potassium, because potassium is one of those electrolytes that will be difficult for the kidney to handle once the kidney function have dropped to a certain level. And hyperkalemia, which is the name of high potassium in the blood, could lead to arrhythmias or changes in the way your heart pumps, properly. So restrict potassium, and there's some foods that are more rich in potassium, and I will just mention those that are more important for the American diet. That includes too much potatoes and some of the fruits, especially let's say oranges and citrus tomatoes, and then the berries in general. Blueberries being some of the best with the lowest concentration of potassium. And then from the citrus, I would say oranges are probably some of the worst. And bananas, obviously, that we all know have potassium. In what pertains to protein, we in the world of nephrology were a little divided among ourselves. I came from the school of thought that too much nitrogen it's not that it causes kidney disease, but basically the accumulation of nitrogen is what makes people sick, because the urea, so-called blood urea nitrogen or bond, is there are about 23 of them. That metabolite or that group family of metabolites is what's going to make you sick, and it's going to throw you into what we call unique symptoms that would lead to dialysis, right? So if you restrict the amount of urea or nitrogen that you eat, you're less likely to get into that sooner. In other words, just buy some time. So I usually recommend that patients with chronic kidney disease restrict the amount of nitrogen, and nitrogen primarily in animal protein. And I say that, not all animal protein is of the same quality. It's not the same to eat 6 ounces of bison or 6 ounces of deer and eat 6 ounces of tilapia or Hollywood or snapper. The fish will have less urea by mass than the deer or the bison. So you can have 160 grams of nitrogen equivalent in 6 ounces of deer, versus you might just find, maybe 20 grams of nitrogen equivalent in 6 ounces of tilapia. So reducing the amount of animal protein that you consume will be ideal to decrease the chances of symptoms. Another area that we don't talk much about is vitamins. Americans, we are fascinated with the vitamins, right? We take multivitamins. People take multiple different forms of vitamins every day. Well, some of these vitamins are also excreted by the kidneys. And so excessive amount of vitamins like vitamin C, which is co-ascorbic acid, could be bad for you if you have a decreased glomerular filtration rate or decreased kidney function. So I think the best way to tailor the diet to your particular needs is to talk to your kidney doctor or your primary care doctor and to be referred to a nutritionist. And the reason is we are all different. I mean, gender-wise to start with, muscle mass to follow, age is an important component. So there's not a particular diet that would fit all, but I think the diet is something that needs to be designed properly for every patient according to his or her needs. And I do some advice about the diet in the office visits, but I'm not a nutritionist, so I don't give specific details. But that gives you a general, flavor for what diet restriction should be for someone with chronic kidney disease.
Yes, thank you so much for the information. That was great. So we're going to move back to Dr. Jaqui Jones. I'll be back up here. So your question is, are there ways to improve your kidney function naturally?
So I'm going to answer this question with care because this is common, because everybody wants a supplement or an herb or a routine that I can do that will reverse my chronic disease, get me off of my medicines and give me great function, right? So let me first, as we all know, I'm an MD, I'm MD trained and I'm trained in Western medicine and I believe in it, right? And so this is not to be substituted for a therapy that one of your nephrologists has put you on or that your primary care doctor has put you on. I think that with that said, I think that to reverse your kidney dysfunction means to find the cause, right? So if the cause of your kidney dysfunction is diabetes, then yes, we can use lifestyle management to improve your diabetes if you're really good at it, right? So in my office, I recommend a low-fat whole food diet that is primarily plant-based, using your meats very limited. And if you're going to have your meats, they should be lean, right? Those are the recommendations. Do I think that kind of diet can ultimately improve your diabetes and eventually you can see creatinine levels resolve? Yes, we've seen that in offices. We know that it's a thing. It's really challenging though to do. So when people say, is there a natural way to change your kidney function? I think there is. I think that you can improve the lifestyle. I think that you can use diet and exercise to control your hypertension. And I think if you control your hypertension, do you see better function of your kidneys? Absolutely. You can go back to your doctor in 6 months and they go, wow, your creatinine level actually looks really good. Good job, Mr. T. And those things can happen. But I don't know that I am certain that there is a single supplement or there's a single medication or a single regimen that you can do that would specifically target your kidney function. I think the kidneys are very reactive to their environment. So if you want to protect the kidneys, you must fix the environment. So if it's a chronic disease, yes, fix the chronic disease. If it's an autoimmune dysfunction, you're at the mercy of your immune system. And so that's a very challenging thing to reverse it, because most of the time the kidneys are at the mercy of the disease, just like you, the person. So there are things that you can work on, and I think that will make things better. But I do not want anyone to think that there is a magical pill somewhere that could be used in place of all the good medicines that your specialists are putting you on or that your primary care doctor is putting you on. But we are willing to always try. So in my office, I read food journals, right? I will walk through every day. We will try different tweaks. We will look at what you typically grab for breakfast and see if there's a way to adjust it in a way that I think is going to be a better meal plan for you long-term that appeals to your palate. And those are challenging, but we will do those. And hopefully a product of all that hard work results in beautiful creatinine levels, beautiful filtration rates, and a lifetime of successful urination. So if we can get that to do those things, then yes, we are happy to try.
Thank you for that. We appreciate that response. All right, we're going to move over to Dr. Holleman. Put you back up here. All right, so the question for you is, how does dialysis work?
Well, if we kind of simplify a couple of different functions of the kidneys naturally, they are to remove waste products from your blood system that your body doesn't need and eliminate them through the urine. and also to help control your fluid balance, eliminate fluids, obviously through making urine. So when kidneys fail, both of those vital functions of the kidneys can be compromised. And so what dialysis is an artificial means to remove those waste products from your bloodstream without the use of your kidneys, and also to pull fluid off as needed. And there are two forms of chronic dialysis. One is called hemodialysis, and that is a mode of treatment where a patient will go to typically an outpatient setting and spend 3 to 4 hours connected to the dialysis machine by way of a large catheter in a large vein, and have their blood sort of cleansed, for lack of a better word. And that's an intermittent form of therapy that requires leaving the home and coming to a center in most cases. The other form of dialysis is called peritoneal dialysis, and that is a treatment that can be done in one's home, and that is done via a catheter that's placed in the abdominal cavity, with a machine that instills fluid into that cavity in and out, typically overnight in our world of pediatric dialysis, but in the adult world, often throughout the day, done manually. And so you have a couple of options. I will say that dialysis does not do what a normal kidney does. In fact, at best, it may only be about 1/3 of what a normal kidney would do. So we hope and anticipate that dialysis is simply a bridge to keep a patient well until they can get the ultimate treatment for their kidney failure, which is a kidney transplant, which I suspect Dr. Zayas will wax poetically on more for you. But so that's it in a nutshell. It's a process by which you are connected to a machine in some fashion, and waste products and impurities are removed from your body through that, and fluid balance is controlled by different mechanisms through that as well.
Thank you. So since we're on the topic of dialysis, I'm going to move over back to Dr. Jones. So the question is, at what point does someone with kidney disease go on dialysis, and is it permanent once you start?
So I think that ultimately the decision to put a patient on dialysis is really not up to me, the primary care doctor. My job is to identify when I think someone is at significant risk and can benefit from it and send them over. But the decision for dialysis is going to be between you and one of these other specialists on here that are going to have a conversation about when is it time. So I'm just trying to prep them so that they do not fall out when they hear dialysis once they arrive, because that happens. And so I am just trying to help them understand where I think we're trending, what I think might happen, and here are all the options and scenarios. But there is a very specific reason to put people on dialysis. So for those of us who don't talk about it all the time in our offices, we still remember the old residential AEIOU thing, right? So, so lots of things can happen to the kidney. So you can become acidotic, right? For me, acidotic patients are my type 1 diabetic patients that always forget to use their insulin and get rushed to the hospital. And because their system is full of acid particles, they tend to do things to the kidneys where they just cannot function. That can be temporary or that can be permanent. Sometimes you can fix it and you can go back down. Sometimes people's electrolytes are just off. Like for whatever reason, we cannot control their potassiums, their sodium counts are all over the place, their chlorides are just not, well, for lots of different reasons. And if someone cannot control their electrolytes on their own, that is going to be my cue to say, friend, I think it's time for us to send you to the specialist or to the hospital, depending on how sick you are, because you may need dialysis. Also, toxins. Can be a reason that you need to be on dialysis, or the kidneys have become damaged. And one of the ones that we do not talk about enough is things like Tylenol or aspirin that people pick up in the grocery stores, and they think nothing of it because they take it. It's right there. It's only $8, and Publix always has it available for me. But taking too much of aspirin, or drinking too much alcohol, or finding alcohol substitutes for people who struggle with alcohol ingestion can be an issue. If you become a water balloon is what we say in our office, but we call it volume overload, right? So some people have hearts that do not pump well, or they have kidneys that don't filter the fluids well, and people become very volume overloaded. So when people start to complain that they feel water everywhere, they say my legs are swollen, doc, both of them, up and down, I can barely walk, everything feels big, I'm having a hard time breathing. If we discover that you got fluids where they should not be, that may be a reason for you to have dialysis. And then becoming uremic. Uremia is a little bit harder for the patient population to understand, but you have people that'll come in and they have a bleeding issue, or they have it may be because they had an inflammation of the surround of the heart, or they've got something that's making them very confused because they've got high protein counts. If there's some reason that something like that is happening, we call that uremia, you might need to have dialysis. Those things can be permanent or they can be temporary. Most of the time, if they're happening acutely, right? If you acutely take too much aspirin and you become toxic, you may need temporary dialysis until we can treat that thing, or they can become permanent. Maybe you have heart failure, or maybe you have heart failure that's caused kidney failure. And because of that, and you have both, you just seem to always be very swollen, very full of fluids, and you cannot pee off enough fluids. We may say you, my friend, are someone who needs to be on dialysis permanently so that we can help your kidneys out, filter your fluids and your toxins. And so those are some of the reasons, right? Maybe not very specific, but that is a lot of different reasons why we assess people, and we have to tell them that it may be time for dialysis. In my office, I don't get to really talk about all those fun things. It's been a long time. My county days, when I did a lot of inpatient medicine, I talked about all those things. But these days, dialysis for most patients is happening because there's been a long history of uncontrolled hypertension or a long history of uncontrolled diabetes, and that over time has just chipped away at the kidneys more and more, that they just do not function well enough to keep up. And those are also times when we have to say, listen, we've been talking about this. We weren't sure if this was going to happen, but I think that we're here. I think you have enough symptoms. I think that your labs do not look stable enough. And I think it's time to send you to the specialist because we may need to help you out in filtering your system.
All right, Dr. Zayas, do you have anything to add to that?
That was very nice, Dr. Jones. I think in adults, what I see the most is that we care for these patients for a long period of time. They progress from one stage to another. We call it different levels of CKD from 1 to 5. And 5 is when the glomerular filtration rate is really, really low. Most of the time people had less than 15, let's call it percent or mLs per minute, and they develop symptoms. So the symptoms that they usually come to the office with is, number one, they're very anemic, and we're treating the anemia, but they're still very anemic. They're short of breath, and they just don't have any energy to do any activities. And that's because the kidneys, as Dr. Holleman said, the kidneys do so many functions that we can only accomplish 1/3 of them with dialysis. Well, they need something called erythropoietin, which is a hormone protein that tells your bone marrow to make more red blood cells. When the kidneys fail or failing, you make less and less, and you become anemic. So here you go. They become anemic. They're symptomatic from the anemia. As Dr. Jones mentioned, they're short of breath. They have very, very large ankles and feet and hands and faces. And despite the water pills, we can't get the fluid off them. And now they're short of breath because they're accumulating fluid in the dependent areas like the lungs around the heart. So that's another reason. They cannot eat. They're nauseous every morning. And nausea every morning, even before they even try to eat, or when they smell a piece of toast or scrambled egg and smells so bad that they feel like throwing up, that is another sign of uremia. When the urea is so high, that makes you symptomatic. Another thing we see with uremia is, as Dr. Jones mentioned, the confusion. They're not themselves. They have problems with memory, with emotions, with sleep, with reactions to their family members. That happens too, and it's part of the constellation of what we call uremia. And then finally, some people present to the emergency room because The family say, he's not waking up, the blood pressure is very low. They check the blood pressure is low. They have a weird rhythm in their heart because the potassium is so high, or because they have so much acid, and the heart is starting to malfunction, and that would be an indication for dialysis. So, these are some of the ways people present. They might present with one, with multiple, but this give you an idea of how uremia usually makes its way into the life of the patient.
Thank you. All right, Dr. Holleman, we have a question that came in. And the question is, if someone has a family history of kidney disease, should they be screened earlier?
It depends on what that disease is. And there are definitely kidney diseases that have a genetic component to them where they're passed through the family. And so depending on the specific disease that exists within the family, that would raise the question of a need to screen the other family member, in our case, the child. Screening can be very simple, and it can just be an evaluation by their primary care physician, which includes a good history and a physical exam, looking at blood pressure, and also a simple check of the urine. So it can be a very simple thing, but the easy answer to a difficult question is that it very much depends on what that disease is.
Thank you. Well, thank you all for joining us today. We don't have any additional questions. I want to thank our experts for providing all this great information about kidney health. So at this time, what I'd like to do is just go around and get final thoughts from our experts, and I'll let Dr. Jones go first.
So,
any final thoughts?
Well, I think that because just to piggyback on like family histories of kidney disease, I think one of the important things that I wish everybody knew from a primary care standpoint is what your family history is. Family history does not guarantee that you also are at the mercy of those things, but it gives you areas of concern that you can make plans for, right? And so it's knowing, are you diabetic or pre-diabetic? It's knowing, do you have good blood pressure control? It's knowing what your cholesterol levels are, and being able to tie those disease processes with changes in lifestyle. So it's getting those 30 minutes of moderate to strenuous cardiovascular activity in 5 days a week. It's adding on a little bit of weightlifting to prevent osteoporosis and keeping your bone density. And it's doing all those things. I think if we could have conversations with our primary care doctors about how to make plans to keep all those chronic diseases at bay or in check, really leads to prevention of kidney disease. Kidney disease does not have to be a rite of passage in most cases. I'm talking about chronic kidney disease. Sometimes the genetic and the congenital things, we just have to deal with them. And that's why we've got these amazing doctors, right? But if we're talking about chronic disease management, if we can optimize your lifestyle, which we're happy to do in our offices, then I think we can really set people up to have the best opportunity to avoid some of the chronic kidney disease side effects that we see in our offices.
Thank you for your final thoughts. Dr. Zayas, your final thoughts?
Yeah, so I would say be healthy, like Dr. Jones said, drink plenty of fluids, exercise, don't gain too much weight, don't smoke, avoid drugs, avoid everything in excess, and try to reduce stress. Now, if you are the unlucky recipient of chronic kidney disease, and the alternatives are 3 only, right? You do nothing, and you're going to eventually go to heaven sooner than expected. Dialysis, that is a way to keep you alive, but at a very high price for most people. If you are a candidate for transplantation, because transplantation is the ultimate, not cure, but treatment for kidney disease. If I give you an example of why why transplantation is better than dialysis, this is how we'll describe it. It will increase your lifespan. So if I were to take 20 people and divide them into rooms, 10 to room A, 10 to room B. And I said, you on room A, you're going to go for transplant because you qualify. Room B, you're going to go for chronic replacement therapy with dialysis, either hemodialysis or peritoneal dialysis. And then I'll come back in 10 years later, I might find 8 people alive in this transplant room, group A, but maybe 2 or 3 alive in the dialysis room, group B. So transplantation will give you a longer life. Number 2, transplantation will give you a much better quality of life. Why? If you are still a young person at a reproductive age, you'll be able to actually, particularly ladies, to conceive a child and carry the child to term. It's very difficult to become pregnant successfully while you're on dialysis. So transplantation will give you that benefit. If you're on dialysis, it's very hard to really engage in very strenuous exercises and sports, for instance, become a professional athlete. But with transplantation, you could actually have a normal, I would say, career as an athlete. You will be able to go back to work full time if you are a transplant recipient. Some dialysis patients are unable to because of the demands and difficulties associated with dialysis therapy. So transplantation will allow you to re-engage with society, be more productive, and certainly have a much meaningful life. The fourth thing is going to give you freedom. Freedom at 2 levels. Freedom to travel and to be free from the dialysis attachments. Because think about it, if you want to go for a weekend with your family to New York City, you're on dialysis unless you make arrangements for dialysis. You cannot depart town. Whereas with a transplant, you can. You just bring the medications and get on with your life. The other aspect is dietary freedom. With transplantation, we always talk about restricting too much fat and cholesterol, salt, and sugars. But in general, a transplant recipient is able to eat a much more normal life and a normal diet, I should say, than someone on dialysis. So my plea to you is, if you have chronic kidney disease, make sure you do the right thing by your doctor, but also ask to be referred to a transplant center to see if you qualify for transplant. Because transplantation is not for everyone, but certainly for most patients with chronic kidney disease who will benefit from the miracle of receiving a transplant.
Thank you, Dr. Zayas. All right, so now we're going to move over to Dr. Holleman for your final thoughts.
Well, I would just like to put a plug in for the importance of primary care. And so to the community out there, pediatric and adult, go see your Dr. Joneses. Okay, please get your annual physical, follow the advice of your primary care physician. In our pediatric world, when we have patients present to us with advanced stages of chronic kidney disease in their teen years, the vast majority of them have not seen a primary care physician in 3 to 4 years. So it's something that often is overlooked, the importance of getting a good annual physical, no matter how old you are, and listening to and following the advice of your primary care physician.
Thank you. All right, well, that was great final thoughts from everyone. I would like to thank everyone online for tuning in. If you have any questions after our live, please make sure to leave them in the comments and we'll respond as soon as possible. If you would like to learn more about kidney health, please visit our Flourish blog on our website. So we look forward to seeing you all at our next Facebook Live Town Hall. Thank you and have a great day.